following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
Welcome to Doctors on Call. Tonight's topic, back pain. Two experts are here to answer your questions. Now here's your host, Dr. Kathy Moffitt.
Good evening. A back problem can strike anyone at any time. You could be taking a swing at a golf ball or sitting at home in your lazy boy recliner. In fact, spine problems cost Americans more than $60 billion a year in medical care. How are spine problems diagnosed? What are the latest treatment options for herniated disc? How can you protect your back from injury? We'll get the answers to those questions and more tonight from our two guests. Dr. John France is an orthopedic surgeon at West Virginia University who specializes in spine surgery, and Dr. Scott Daffner, also an orthopedic surgeon at WVU. If you'd like to ask our guests a question, give us a call. Our phone lines are now open. So John, how common, how prevalent are spine back problems?
There's really very few people that get out of life without a back problem. I mean, 70, 80% of people, some point in their life, will experience some significant back problem of varying degrees, varying severity that lays them up that they seek treatment for. So the majority of people.
And Scott, how easy is it to figure out what the cause of back pain is?
Well, that's sort of the million-dollar question. There's about 1 million different things that can give you back pain, and that's what makes our job so difficult. It can be just simple degenerative changes within the back. It can be strains of the muscles. It can be problems with some of the soft tissues. It could be a fracture. It could be just about anything you can imagine can give you back pain, and that's really where the challenge lies. So
we were talking earlier about degenerative back pain. So you're kind of predisposed by your genetics, by your family, and
yeah, unfortunately, some of back issues has to do with what you do and what work and recreational, but unfortunately, a large part you're genetically predisposed to, and how your back wears and ages, in large part, is probably predetermined.
And smoking plays a big role, though, in as a risk factor for degenerative changes.
Yeah, we're all aware of heart disease and lung disease, but what people don't realize is smoking affects a lot of processes, including the vascularity of your discs, and we know that disc wear is more prevalent among smokers, and so are disc herniations.
So it's the blood supply to the discs get cut off or smaller as much as we understand from smoking.
That's one of the suspicions.
Yeah. So we are a state, I guess, do we have more back pain and back spine problems in West Virginia because of the smoking rates, or is that hard to say?
Hard to know. I don't know the data or numbers, but we're certainly a heavy tobacco use state and smoking state, and I would suspect that plays a role.
So what are some other things to keep your back healthy? What are things you can do?
Well, generally, anything that is going to keep you healthy from a general standpoint that we talk about, and that's things like maintaining a healthy weight, staying active, again, the tobacco use and smoking with particular reference to the spine, and in particular just through your daily life, paying attention to how you're lifting things, how you're moving, and really your work environment.
Okay. We have a question from Julia in Tucker County. Hi, Julia. What's your question?
What do you do for degenerate vertebrae in your lumbar when they bother you?
Okay, so
what's the best thing?
So degenerative, we've been talking about that, and then in the lumbar area is the lower part of your back.
Correct. Right. So a lot of times when we start to look at patients with back pain, we find what we call degenerative disc changes or degenerative wear. And it's important to clarify that because that's a natural process that probably begins in our teen years and progresses through life. By the time people reach 60, there is nobody without degenerative disc and degenerative wear change in their backs. Sometimes those changes are responsible for back pain. Sometimes they're not. It's very difficult to sort that out. So they tend to get lumped in the group, and most degenerative back pain are people that we treat non-operatively with exercise programs, anti-inflammatory medicine, encourage a level of smart activity, as Scott pointed out, using good lifting mechanics, and most of that's managed non-operatively.
So, Scott, most people don't need to have surgery on their back, is that right?
Right. By and large, the majority of spinal problems that we see really can be treated non-operatively, and most patients respond to that non-operative treatment. John and I are both surgeons, and we represent an endpoint of a spectrum of treatment that begins with concerted non-operative care and works through a number of different steps until you get to the point that really nothing else has worked. And even in the subset of patients that ultimately end up going on to get surgery, that doesn't necessarily help everybody.
So let's say I get an MRI and I have changes on my MRI because of my age, and maybe I am, maybe I'm not having back pain, but I read the report and I say, oh my gosh, I've got a disc herniation. Does that mean I need surgery, or
No.
what does that mean?
So what it probably means is your discs are starting to bulge and wear, and the radiologist, your herniation takes on a lot of different meanings, and it's almost, it can be used very generically like Kleenex for a tissue. It gets thrown out there a lot, and so people that have specific disc herniations that end up with surgery for the most part, are done for people that have leg pain. Okay. And they're not done for back pain. And so when people have back pain and read that they have a disc herniation, probably it means they have some degenerative disc wear.
So it's like having wrinkles or having gray hair. It's part of maybe getting older, but it doesn't necessarily signal that that's the cause or the problem, or that you need to have surgery.
The hard part is it actually can be the cause. It's just distinguishing those that aren't the cause and are very difficult.
Right. So we have another caller, Ernie in Tucker County. Hi, Ernie. Go ahead.
Hello.
Hi.
Hi, doctor. Hello.
Yeah, go ahead.
Hey, I want your opinion on something. I've had 3 unsuccessful back operations, and I've been in constant pain since about 1970. And I also have no feeling at the bottom of my left foot. And I'm not sure, it's probably due to damage to the sciatica. Is there any hope for me?
So can I ask roughly how old you are?
I'm 70. I'll be 74 in June.
Okay, and do you have diabetes?
Yes.
You do. And how long do you think you've had diabetes? Since 1970 or
No.
more recent? Whoops, we lost him. He said no, maybe a little more recent. So several back surgeries and still having pain.
So it's difficult to be real specific without looking at somebody's x-rays and images, and there's a host of reasons why he could be struggling. Back surgery is not for everybody, and there are certain portion of patients, depending on what the back surgery's done, that it will be unsuccessful. And so it's always important for our patients that we sit down, even patients we think may be a candidate for surgery, under the best of circumstances, a portion of those people will probably not get better. So we try to outline that for them. Once somebody's had 3 surgeries, never has gotten better, and many years has passed, you can't be very optimistic about helping them, but it's never, you would never say to somebody without looking at their images that you can help them, but that is a very challenging circumstance.
Right. We have another caller, Dee Dee in Harrison County. Hi, Dee Dee, go ahead.
Hi, yes, doctor. I had not only degenerating disc, but I have bulging disc, and I'm diabetic, and I do take physical therapy, and I also take care of my 80-year-old father and lifting on him and tending to 3 acres. What else is it that I can do to help my back pain, because it is now making my legs also.
Thank you.
So, so having a bulging disc and then doing some lifting of her father and doing a lot of other work.
Right. And again, you know, this is what sounds like really part of a kind of a degenerative cascade within the spine. So as arthritis and things progress in the spine, we see bulging of the discs. It puts you at a risk if you're perhaps move in a different way or twist in a certain way. It might put extra stress on that disc and can cause it to herniate. The physical therapy, I think, is, for me personally, is one of the mainstays of our non-operative treatment. Really strengthening the core muscles and things like that to help support the spine kind of secondarily. You know, without getting into real specifics as far as other treatments, certain types of medications, if the pain is because of arthritis or inflammation, the anti-inflammatory medications are usually a good place to start, and even just the over-the-counter medications rather than the stronger stuff.
Right.
The other possibility for, particularly, it sounds like she has to take care of a larger yard, and is there are a variety of different lumbar corsets, braces, and you have to use them judiciously, because really what you want is a strong, flexible back, and overuse of a corset can give you a weak, stiff back, which is not what you want. But to wear them for specific activities that sound like she may have to do, there are many different brands, and trying them on and finding one that may allow you to do those activities without suffering is sometimes worthwhile.
Yeah, so we should talk about activity in a bit. So we have another caller, Sue from Lawrence County, Ohio. Hi, Sue, go ahead.
Hi. Well, I kind of feel like they just finished answering my question, but I personally have a herniated disc, and they're telling me that around my spine it is continually deteriorating, and if I walk or stand for 15 minutes, 20 minutes, a half an hour period at a time on a concrete floor, I mean, my back is just breaking in two. And I was wondering if, not surgery, but, what I could do to avoid surgery with this problem.
Right, so standing, what is it about standing in one place that aggravates? Is it just the pressure on the back?
I think a lot of it is that, it's, as you stand and as you're upright, all of your weight from your upper body is passing down through the spine. If your discs are degenerated or they're bulging a little bit, or if you have a little bit of instability in there, it can load the spine in an awkward way. As we get older, and the discs, which we've been talking about a lot, really act as shock absorbers within the spine between the bones. And so over time, as they degenerate, they lose some of their water content, and they lose that ability to absorb the shocks of just daily life. And so as you're standing upright, or if you're loading it, if you're jogging, or you're otherwise putting stress through it, that can certainly exacerbate things.
So we talked a little bit about activities, but so recently we've had a lot of snow, so shoveling snow, is that a good activity or bad activity for your back, or lifting suitcases? I mean, some of the things?
It certainly is good to exercise your back. It's good to be active. Years ago, people used to talk about when you had a back strain to go to bed rest. We don't do that anymore. We sort of encourage active rest under those circumstances. The back, the discs are not very tolerant of twisting activities. And probably the worst activity you can do for your back is to be bent over, reaching out in front of you, and twisted. So, for example, in a suitcase out of the trunk of a car where you're twisting to the side, trying to yank it out of the trunk of the car is very tough. A big, heavy shovel load of snow that you've taken from one side and are twisting to throw, very tough on the back. So you're better off to square up to things. And
right. So the woman who was saying she's lifting her father, learning in the proper ways, so she's not leaning over trying to get him and twist over. Yeah,
patient lifting and that kind of activity is hard on the back, and there are good ways to do it to help spare your back, and learning those would probably be worthwhile for her.
So we have another caller, Gordon from Fayette County. Hi, Gordon.
Hi.
Hi. What's your question?
Okay. Approximately 6 years ago, I come home from work, laid down in bed, got up to use the bathroom, and a icky feeling come over me. and I went back to the bed, and when I fell in the bed, I locked up in that position. All my arms and muscles and my legs, my whole body was in that one.
We seem to have a little connection, but it sounds like he got up, and then when he went to lay down, he kind of had a lock-up of his back and position. Is that more muscular spasm, possibly?
What happens, I think some people in those circumstances, you'll hear people say, I bent over and all of a sudden everything spasmed up and I was locked up and couldn't move. And there's probably nothing mechanical. If you could magically make all the muscle where their back would move, but they've done something in there that's created a sudden pain. They've twisted their disc, they've moved their joint funny, and their muscles will spasm up and contract very vigorously in an attempt to protect. It's almost like getting a cramp in your leg, and that cramp, the muscles will just tighten up and cramp, and you can't move, and anytime you move, you're trying to undo that cramp, and it can be pretty painful. And I think most of the time when someone say my back locked up, that's generally what happens.
Yeah, my back goes out. That's what they mean by that. Now, what about as we age, and especially for women, a lot of osteoporosis? Are there things you can do if you're back for injecting, putting things in to make the discs perhaps stronger?
Well, the biggest concern with osteoporosis, which I think it's important to point out affects men as well as women as they age, is the risk for getting fractures related to the osteoporosis. And as the bones thin through the process with osteoporosis, you're at risk for sustaining fractures, whether it's in your spine or your hip or your wrist, if you fall. Even relatively minor injuries that are seemingly benign can cause a fracture. And the most important thing with osteoporosis really is prevention, and making sure that your vitamin D and your calcium levels are appropriate, and there are certain other conditions that your family doctor can test you for that certainly would predispose you for osteoporosis. But once you sustain a fracture related to that, within the spine there are a number of different treatment options. As with anything else, the initial treatment is non-operative, and most patients who have osteoporosis-related compression fractures in the spine will get better with about 4 to 6 weeks of non-operative treatment.
Right. We have another caller, Larry from Wood County. Go ahead, Larry.
Hi. I had an MRI, and I have a bone spur in my cervical spine up near my C5 and C6 of my cervical spine.
Right.
And it pushes against my spine, which makes my thumbs numb. What is the outcome of this? Is this serious, that you have a broad bone spur against your spine, at your cervical spine?
Right, so the cervical spine in the neck, and he has a bone spur.
You have to be careful. There are two types of nerves in your neck. There's the main nerve or the spinal cord, and when you have pressure against that, it's actually not usually painful, but can cause some serious loss of function. That's one of the circumstances we generally recommend surgery as the main treatment. It sounds like what you have is the second type of nerve irritation, which is irritation of the nerve root, or what we call radiculopathy, where the spur is affecting the nerve as it's exiting the spine, as it's leaving the spine, and that will usually affect one arm. It can be very painful, and it'll affect the distribution of the nerve that's irritated. So a 5-6 disc with a spur, if it affects the 6th nerve, which is where it would give you numbness and tingling into your thumb. That can generally be treated non-operatively. Cervical traction's one thing, medication, other forms of therapy, even some injections at times. The patients that don't get better with that kind of regimen, a lot of times there are surgical things that you can do to try to help that, specifically the arm symptoms, the tingling in the thumb more than the neck pain itself.
Right. So we have Gordon back on the line from Fayette County. Sorry we cut you off earlier. Hi, Gordon.
Yes, ma'am.
So you were talking about this, that your back got locked.
Yes, yes, sir.
And then how have you treated it, or what's been the outcome in the 6 years since that happened? Or what, do you have a question about it?
I keep getting passed from doctor to doctor. What happens is I got all the symptoms of someone with MS, that my arms will go numb and tingling, my shoulders. My brain will tell my arms and legs to move, but they're rigid and they're locked up, and even 2 or 3 men cannot not pry them apart. It's like having a giant muscle cramp from my neck down. It went from months to every 2 weeks to daily. They got me on steroids now, which seems to help, but I still have to use a walker. This started when I was 30 years old.
So it's been going on for 6 years.
Yeah.
I have no lesions.
Okay.
So sounds like a little different than what we were talking about with the muscle and the back spasm.
So what we talked about with the caller before this, with the, for example, with pressure on your spinal cord, the main nerve in your neck, you can get symptoms that mimic MS and other disease processes in that you get spasms of your muscles, cramps, and the two can look very similar. Certainly, if no one's looked at an MRI of your neck, that would be worthwhile doing. It sounds like you've had a pretty thorough evaluation, and my suspicion is at some point along the way they would have MRI'd your neck, but had they not, that would certainly be a reasonable place to check.
So he said he had no lesions, which I assume meant on his MRI, because in MS, multiple sclerosis, you'd expect to see
Correct.
the
you
changes
can see
on
them
the
in your
right.
spinal cord. A lot of times they MRI the brain, though, and look for them in the brain.
Yes.
So they may or may not have looked at the neck. I suspect they have, because
Right.
it sounds like he's had a thorough workup.
And sounds like he is getting some help from the therapy, the steroids he's on. So we have another caller, Anna from Fayette County. Hi, Anna, go ahead.
Hi.
Hi.
I'm 49. I'll be 50 this year. I have scoliosis. I was only diagnosed a few years ago, and I have asthma, and it burns from time to time right between my shoulder blades. I didn't know what it was, and I thought it had to do with my asthma, because at times there'll be a band. It feels like a band around my shoulder blades and then a band around my lungs at the same time. Usually when I'm having problems with my back, the scoliosis, I have trouble with my asthma too, and I want to know, what can I do about the burning in my back? No medicines help.
So scoliosis, which is a curve of the spine, she's kind of late to be diagnosed. Aren't most kids are diagnosed with scoliosis, or?
Usually, the sort of run-of-the-mill routine scoliosis we see is very frequently picked up, generally in younger kids, because we've done a better job of screening for them in schools. But every once in a while, there are cases that get missed and not diagnosed until adulthood.
Is scoliosis all from the growth of the spine for kids, or are there other causes that can occur later in?
There are a number of things that can cause it. Certain congenital abnormalities or neuromuscular diseases can cause certain types of scoliosis. For example, patients with cerebral palsy very frequently can go on and get scoliosis.
Right, it progresses and they get more of a curve as they get older.
Yeah.
So what kind of things for someone who's in their late 40s, almost 50, you know, it sounds like she's being treated for her asthma, and then she gets this pain in her back, and
well, that's the what I would say slightly concerning issue in her case, because generally speaking, scoliosis is not a painful condition. Sometimes in older individuals who have kind of a degenerative cause of their scoliosis in their low back, yes, we see back pain, but pain that radiates out from the back, either sort of around the rib cage, or if you had pain down the arms or the legs, is a little bit more concerning. That perhaps there's something pushing on the nerves that is either causing the scoliosis or just causing the pain.
Right. So we have another caller, Charles from Kanawha County. Hi, Charles. Go ahead.
Hi. Yes, I have arachnoiditis, bacterial surgery syndrome ×3, and arthritis, and a bunch of things. And I know doctors in West Virginia are afraid to get pain meds out in Texas. And for 6 years I got pain meds, no problem. Here, they told me that the DEA is really hard on them. They're afraid to give meds, so I can get as Norcos, actually. I was wondering if you could touch on this some.
So pain medications, it's a tough thing. People have a lot of back pain, but use of narcotics for
Well, for short periods of time, when someone calls, for example, call said his back spasmed up, and a short, brief spell of even narcotic pain medicine is certainly not an unreasonable thing to help somebody get it through it. The difficult issue comes with chronic, long-standing pain that may not go away.
Right.
And so that's a very difficult task and often counterproductive in the long haul. It actually often makes the pain worse as the years go by. So we would discourage it.
Yeah, we've been talking about spine problems with Dr. John France and Dr. Scott Daffner. Thank you both for being with us. If you'd like more information, see your family doctor or visit the WVU Healthline website at wvuhealth.com. For Doctors on Call, I'm Dr. Kathy Moffat. Good night and good health.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.